Homelessness in America is not a personal failure. It is a policy failure. People don't become homeless because they didn't try hard enough. Research shows that homelessness happens when systems fail, when housing costs too much, when jobs don't pay enough, when healthcare is hard to get, when public policy ignores real needs. These broken systems work together, and people fall through the cracks. We see it every day. On our streets, in our parks, in shelters among children, veterans, and seniors. Homelessness is the result of bad decisions and misplaced priorities, not bad people. And here's the truth. We know that providing housing first save lives and money. The first and most powerful driver is simple economics. Housing costs have outpaced wages for millions. Rents have surged while real wages barely moved. In nearly every county, minimum wage won't cover a modest one-bedroom. Work has become volatile. Inconsistent hours, unpredictable pay, few benefits. A car repair, a medical bill, a cut in hours. One shock can trigger eviction. When over half your income goes to rent, every other necessity becomes a gamble. Do you pay rent or buy groceries? Fix the car or keep the lights on? Eviction is a primary pathway into homelessness, and it's driven by rent shortfalls. Even though mental illness and substance use disorders are more prevalent among the homeless population, psychiatric research largely views these conditions as risk factors that interact with, but do not solely cause, homelessness. The systemic failures in providing adequate, accessible mental health care and supportive services, deinstitutionalization cut in psychiatric beds without building community care, the promised safety net that never fully materialized. Too many cycle between ERs, jails, and the streets without sustained help. People leaving jail face housing denials, no savings, and stigma. Without a housing plan, the risk of homelessness is extreme. Youth aging out often lack family support and resources. These aren't isolated failures. They're patterns of fragmented systems. Healthcare, justice, child welfare, people get shuffled while housing goes unaddressed. Fragmentation pushes people further into crisis. The crisis is not evenly distributed. Racial inequality is central. Black Americans are 13% of the population, but nearly 40% of people experiencing homelessness. Historic housing discrimination created lasting wealth and opportunity gaps. With less wealth to absorb shocks, eviction risks rise. Inequities in work and justice systems compound housing exclusion. A colorblind approach fails. Solutions must center racial equity. Target resources, dismantle barriers in housing and social services. A just response closes racial gaps and strengthens society for all. Shelters prevent deaths in extreme weather. They are necessary, but not solutions. Too often, people cycle back to the streets. Transitional housing helps some but is costly and time-limited, creating cliffs. Housing first provides immediate, permanent homes without preconditions. Voluntary services then support health, employment, and personal goals. The vast majority remain housed for years, even with serious challenges. The barrier isn't evidence. Its resources and policy will. Stable housing unlocks stability everywhere else. Expand vouchers like SNAP. Only 1 in 4 eligible get help today. Models show large reductions in housing instability, poverty, and homelessness. End exclusionary zoning. States can require diverse housing types. Allow duplexes, townhomes, small apartments, especially near transit. Build more homes in high-opportunity areas. Integrate housing and healthcare. Right to counsel dramatically cuts evictions. Pair rent help with job training. Prevention is cost-effective and humane. Given that anecdotal evidence and scholarly studies shows that macro-level economic shifts, such as income inequality, a lack of affordable housing, and stagnant wages failing to keep pace with rising rents, help to price many individuals and families out of stable housing markets, particularly in urban areas with high costs of living. Leaving people on the street costs more than housing with services. Permanent supportive housing saves public dollars and lives. Government should direct resources where harm has been greatest. Treat housing as a human right, not a commodity. Expand supply, link health and housing, and plan inclusively. Fund housing first, universal vouchers, and eviction defense. Homelessness is a policy choice. We can make it rare, brief, and non-recurring. The moral and fiscal case is clear. Let's choose to end it. Please share and subscribe for more.